So under-eye dermal filler is an area of growing popularity. Obviously, if you have a little shadow underneath your eye, it often represents tiredness, and for some people it makes them be perceived as older or less fresh is often the term people use. So there is a treatment available where we revolumize some of the lost fat pads underneath the eye and give them an instant sense of freshness and youthfulness by adding this product underneath the eye. If you're just looking into this for the first time, it's very important to choose an experienced practitioner, because the skin is so thin underneath your eye that there isn't very much leeway for making kind of gross mistakes. You know, everything has to be very well controlled, small amounts at the right time, and almost sculpted and shaped perfectly on the day that you have the treatment. So the next thing I'd say is make sure they're using a product that retains the least amount of moisture. So there are two dermal fillers that seem to lead the way in this area. There is Tear Density 2, which is commonly used for tear trough, and my personal favourite is juvederm bulbella. So these products will attract the least amount of moisture, and they're very soft. They don't reflect light in the way that some products do, so you don't get a blue tint underneath the eye anywhere near as commonly as some of the products that have been used in the past. They tend to last quite a long time, and it's generally, when done with a cannula, a surprisingly comfortable treatment. So a lot of people think that's probably one of the most painful areas, but surprisingly one of the least painful areas that we treat. In terms of what's involved with the procedure, it's often called medically the tear trough procedure, and if you search our website you'll find lots of information under the heading of tear trough. And what we do is basically place small amounts of filler, usually with a little cannula. So cannulas are a blunt tip instrument, but they look like a needle. The benefit of them is that it's not sharp on the end, so once you're in the skin, they cause minimal amounts of trauma. So it's a little bit more like keyhole surgery, in that one little entry point and you can reach all around the area and gently just add a little bits of volume where it's needed. It takes around 20 minutes. It lasts, you should see the results straight away, although you might be a little bit red for a while afterwards. Because of the use of cannulas, bruising is much less common than it used to be when we used needles, and should instantly make you feel fresher and happier.